Good afternoon. My name is Linda Kreppel. I'm the RFP coordinator for the Community Partnerships Division under the Human Services Department, and this is the applicant workshop for the fiscal year 2021 Housing Services for Homeless and Ryan White Part A Minority AIDS Initiative Medical and Support Services. Today is November the 5th. It is 3 o'clock, and I do want to make a couple of observations before we continue. If you're on Vimeo listening now and you need to have a question answered, you're going to go to the chat room feature on the right-hand side of your screen. You're going to enter the name of your agency and your first name and then join chat. Then you're going to accept the terms of services, join and ask your question. That's how we'll be able to answer any questions that you may have regarding this RFP. So before we continue, I'd like to introduce the Director of Community Partnerships Division, Mr. Daryl Cunningham. Mr. Cunningham?
Hello, everyone. I can't say good afternoon because I know that some of you may also rewatch this at night or in the morning. So just greetings from Broward County Human Services Department. As Linda mentioned, my name is Daryl Cunningham, and I'm the director of our Community Partnership Division. I want to thank you all for your interest in working with us. I want to encourage you all to ask as many questions as you can during the allotted time frame. Would really encourage you all to look at our websites and some of our past proposals, past RFPs, and just read the document as thoroughly as you can. We pride ourselves on ensuring the services we are putting out for bid are items that are definitely needed by our community, and so we are looking forward to getting your proposals and reviewing them, and we're looking forward to the work that we have that's going to come out of this RFP work. Again, welcome. Thank you again for your interest, and thank you again for your partnership, and look forward to collaborating with you and your agency and your staff as we serve those who are in serious need in our community. Thank you.
Thank you, Mr. Cunningham. I wanted to share with you that all RFP-related information will be posted on the Community Partnerships Division website. That's where you were able to download the information on the RFP. I do recommend that more than one person from each agency be registered on the CPD site to become aware of any notices that are posted. And then again, using the chat feature on Vimeo, send your questions to the link on the area provided. There are two clarifications and updates to the RFP. The first one is under Homeless Initiative Partnership. It's the eligible population of focus, also known as participants. The RFP currently reads, the population of focus for DV Family Homeless Street Outreach is persons experiencing homelessness as defined by HUD categories 1 and 4, 18 years and older. And it should read for all HUD advertised services, the eligible population of focus are persons experiencing homelessness as defined by HUD categories 1 and 4, 18 years and older. The second clarification is for ESG Homeless Coordinated Entry and Assessment, Domestic Violence Homeless Street Outreach, under the eligible billing components. It currently reads administrative services and the service number, client incidentals, temporary flex funds assistance, homeless outreach, supportive services, housing navigation, housing search, COVID-19 control, and it should read under the required services, administrative services, client incidentals, temporary flex funds assistance, homeless outreach, COVID-19 control. There are no housing navigation or housing services for eligible billing under the domestic violence family homeless street outreach. The agencies eligible to apply for this RFP are nonprofit organizations incorporated in the state of Florida and have an active 501c3 status as per the state of Florida. Public entities that are defined as municipalities, state government agencies, or political subdivisions of the state. For housing services, tribes and public housing agencies are eligible to respond. The services must take place in Broward County. That is non-negotiable. For-profit organizations are not eligible to apply for any service advertised under this RFP. Some RFP basics under healthcare services for Ryan White MAI. The initial contract period is estimated to be March 1st, 2021 to February 28th, 2022. These grant agreements may have the potential of 2 one-year option periods that are dependent upon the availability of funds. The Homeless Initiative Partnership Services, the estimated terms of services is January 1, 2021 and ending June 30th, 2022. All option period funding are contingent upon services in line with the Human Services Department strategic plan, continued need for services, satisfactory performance of the program, and the availability of funds. Important timelines and deadlines that need to be brought to your attention. As a result of this workshop, all applicant agencies have the potential to submit written questions on any areas of process, procedure, of service delivery. The written questions must be submitted November the 9th, by November the 9th, 2020, 5 p.m., no later than 5 p.m. It's something that's new this year. We're asking all questions be emailed to the email address that you see there, which is hsdproposals@broward.org. Written responses will be posted Monday, November 16th, 2020, on the CPD website. Again, that's the same website that you downloaded the RFP on. The due date for complete proposals to be submitted is Wednesday, December 2nd, 5 o'clock. We are not, and I hear the yays out there already, we are not requiring any hard copy packages to be delivered. Everything this year is going to be submitted electronically. The proposal packets will go into more detail a little bit later. All proposal packets, complete proposal packets, must be submitted via email to hsdproposals@broward.org, and they must be received before 5 p.m. That's critical because if there's any delays, we are using that email delivery as our proof of delivery timestamp. So please make sure that you consider that when sending and developing your time frame of submitting a proposal, as late submissions will not be considered for funding. To continue estimated timelines and deadlines, applicant interviews will be held December 14th, 15th, and 16th. They will be held via Microsoft Teams. Applicant agencies that are invited to participate in an applicant interview will be sent a specific invitation that they can forward to people from their agency that can respond to programmatic or budgetary questions. We estimate that December 18th, the notices of funding recommendations will be sent, and board approval is estimated to occur on February 2nd. The incoming mayor, we don't know who that will be. We don't know what the dates will be. That's why everything is estimated at this point. Once we do have a specific date identified, that information will be conveyed to potential applicants. Information requirements regarding this particular grant process. All the information is available in the provider handbook that's online. Go to broward.org, follow the links to go to community partnerships, then go on the bottom right-hand side, check provider handbook, and that's where you will be able to see the county policies, the information, guidelines, sample documents. If in the review process you have an issue, you forgot to have a signature or a date, Broward County has a policy that we will request that document be updated. You're allowed 24 hours to resubmit a corrected document. The CURE policy is referenced also in the RFP. Financial review is going to be the program budget review. Attachments are generally related to policy compliance. Program documents are requirements for the specific proposed program that we are requesting, either licensing information or additional information on how you're going to comply with the advertised service guidelines and service delivery models. Additional information regarding budget. There is a budget form that you would need to fill out to submit your program budget for Healthcare Services Ryan White. There is a separate spreadsheet to download for the HIP, Homeless Services. So you must make sure that you are using the correct budget form. Those are noted specifically on what to take a look at. If you have a question, please email me. It is critical you use the correct budget form. Services in the provider handbook are effective October 1st, and there's a separate listing underneath the provider handbook, also on the Broward, that you can access through the Broward.org website to receive the specific definitions for the taxonomies, credentials, unit rates, etc., that are eligible for billing purposes when you put your budget together for this RFP. That provider handbook information also gives the liability requirements for that for insurance purposes that you must have in place if you're going to apply. A match policy, there are no match requirements for services advertised in this RFP. However, all applicants must be cognizant of the disallowed expenses. Those are listed on page 8. Depending on the funding, there are some items that are allowed under the ESG. So please be very careful as you develop your budget to make sure that you are not including any disallowed expenses. For those of you that have downloaded the RFP in the past, we used to have a Part 1 and Part 2. That no longer exists. There is only one application form. It's in a PDF, a fillable form PDF, that you would go ahead and fill in. Should your response require additional information other than what is applied, then you would need to fill out some additional, you need to provide your additional response and include that in your proposal package. The RFP goes into detail as to how you should note your response, the section it comes from, and the response number. Because again, this is what the raters are going to be using to assign a quality score to your proposal. So you need to make sure that it's as easy as possible for the reviewers and raters to find that information. That's why it's critical that you reference the section and question number on your additional response, should you have one. For those of you that submitted proposals last year, you are aware that we have now a mandatory use of service delivery models. This is a document that provides guidance. It's like the roadmap on how to deliver the service. It will tell you what we're looking for and what our expectations are from the county. Coming up in the after the advertised services presentations, we're going to go over the budget spreadsheet a bit more, how to organize the packaging proposals in this new environment, submitting your proposal, inquiries, and contacts. At this point in time, I'm going to go ahead and turn it over to Healthcare Services Section Representative Shakira Scott, the Project Program Coordinator. Please go ahead and come on up. Thank you.
Good afternoon, everyone. So Healthcare Services will be procuring the services of MAI, Integrated Primary Care, and Behavioral Health in the amount of $293,826. The information as to eligibility and the opportunities are listed in the RFP. The eligibility requirements are population must be residents of Broward County, living with HIV and AIDS, not retained in primary care or behavioral health, and not virally suppressed, earning less than 400% of the poverty level, uninsured, or have barriers to economic stability. Okay. The other service category will be MAI, Trauma-Informed Mental Health. The estimated amount is $62,469. Again, the eligibility criteria will be Broward County residents living with HIV and AIDS, not retained in primary care or virally suppressed, 400% of the federal poverty guidelines, uninsured or have barriers to economic stability. MAI, substance abuse, outpatient. The estimated funds will be $400,000. Again, the eligibility population will be Broward County residents living with HIV and AIDS, not retained in medical care, or virally suppressed, earning less than 400% of the federal poverty guidelines, uninsured or have barriers to economic stability. Health insurance premium and cost-sharing assistance. The estimated funds will be $798,877. This is an opportunity for us to provide financial assistance for eligible individuals with Affordable Care Act marketplace plans identified by the Ryan White Part A program. The eligibility criteria, again, Broward County residents living with HIV and AIDS, earning less than 400% of the poverty guidelines, uninsured or have barriers to economic stability, and having no other means of funding source to receive services. I will turn it back over to Linda Kreppel.
Do we have any questions coming in on the chat room? Excellent. Okay. Then at this point in time, I'd like to invite our next presenter to come up, Ms. Rebecca Require, PhD, who's the administrator of the Homeless Initiative Partnership.
Okay. Hi, good afternoon. This is for the Homeless Initiative Partnership. What's great about this is all ESG for those providers who are familiar with emergency solution grants distributed through the Department of Department of Children and Families. Is that this specific pot of money, we want to reiterate, has zero match. These funds must be expended between June 30th, expended by June 30th, 2021. There is a possibility of an extension to align with the federal fiscal calendar of September 30th, 2021. That will be assessed by the Department of Children and Families on a case-by-case basis. Also, for these services advertised under HIP, there are no outcomes, but there are DCF deliverables. You'll see in the RFP and in the service delivery models the form that will need to be completed monthly regarding the deliverables that the selected providers will have to provide. So the advertised services that we have are kind of exciting. Just give me a second, I'll move the slides for you. I'm going to try to move the slides for you. Thank you, Linda. This is a new service. The first one is Emergency Solutions Domestic Violence and/or Family Street Outreach. Let me give you a little explanation on this. We are looking for providers who would provide street outreach for a specific subpopulation of domestic violence. And then we are looking for providers who would provide street outreach for families specifically. A provider could perform both duties, but these would be separate contracts. So we're looking at two different subpopulations to provide street outreach. The second is individual and/or family rapid rehousing. The third one is a new procurement for HIP, and that is mobile sanitation projects, and we'll go into more detail on those. Shelter operations and essential services. This is a traditional ESG category. And then housing case management and housing navigation. Generally, you will see housing case management and housing navigation tied to rapid rehousing. However, we have pulled these out as a standalone service, so you don't necessarily need to provide rental assistance to apply for this service. So for all services, this was a correction that Linda had mentioned at the beginning of this presentation. All services will need to serve the population of literally homeless. That is categories 1 and 4 as defined by HUD. So category 1 is on the slide that you see in front of you, and basically, I'm not going to read the slide to you, but it's basically looking for those individuals who are sleeping in a place not meant for human habitation. That could be their car, that could also be a shelter, that could be on the street, parking lot, anything of that nature. It also are people who have been living in an institution for 90 days or less, and who resided in an emergency shelter or a place not meant for human habitation prior to entering that institution. So category 4 is households fleeing domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions. This includes human trafficking. So the categories of fleeing or attempting to flee, has no other residence, lacks the resources or supports to networks to obtain other permanent housing. So those are the two categories. Also, individuals who are eligible for this, participants need to be ages 18 or over. So the first category that we're going to review will be the Emergency Solutions Grant Domestic Violence Family Street Outreach. We have allotted $700,000 for this category, and as I said, we will be looking for perhaps multiple applicants to pick one or both of these subpopulations to provide a response to. This is a great opportunity. Again, this is new. We're looking to expand our street outreach. We're looking to see how we can better reach these subpopulations that we know from our point in time count have been on the increase in Broward County. We're looking for innovative practices or evidence-based practices which strengthen your proposal, so do some research on that. And again, one or more providers can apply for this. So each of your applications that you will be submitting will have two sets of attachments. One will be the attachments, which Linda spoke about. So for HIP, pay close attention because for the attachments, they're pretty standard across for all services, but when we get into the program documents, rapid rehousing has a very different and specific set. Your first attachment is going to be your agency assurance form. If you're an NPO, which are the population, or which are the agencies eligible for this, you'll need to provide proof of your IRS 501c3, your criminal entity crimes affidavit, and then a list of your board directors. For your program documentation for this specific services, which is outreach, you'll do program document number 2, which is the Gantt chart for how you would bring this project online. What's really critical about document number 2 is as you can tell, there's a very short turnaround on this project. So it really cannot take 3 to 4 months to get a project up and running. You need to be able to provide in your Gantt chart the ability to get this very quickly up and running. So please be prepared to explain that in the Gantt chart. Program document number 3, any MOUs, MOAs, or interagency agreements would need to be provided. Document number 4 would be any resumes or job descriptions for the staff that will be funded under this project. And then document number 5 would be a table of organization for those responsible to implement your project. And then program document number 7 is certain flex fund policies that you might have. What do you include in flex funds? What do you disallow? To ensure that you absolutely have a policy, and then how you track flex funds, but also to ensure that it's in line with what is allowed as an allowable expense under ESG. So the taxonomies or the eligible expenses would be administrative services, your client incidentals, your temporary flex funds assistance, your homeless street outreach, and then there's a COVID-19 control, which is a taxonomy to bill items that may not fit under any of the other listed above expenses. The next category is the ESG, individual and family rapid rehousing, and it's about $1.5 million allotted to this service. Again, what we're looking for is perhaps multiple providers to submit applications to provide this. This would be for individuals and or families. We prefer to have look at how many households you're going to serve versus how many individuals versus how many families, so that when you are building your budget under this, look at how many households that you would be able to support, because there is a household of 1 and there's a household of 1 plus however many to get to your families. Rapid rehousing projects are services that provide social services, tenant-based rental assistance to individuals and families experiencing homelessness and in need of temporary assistance to obtain and retain housing. An applicant may also apply for case management and housing navigation under this service. The county will consider more than one applicant. So as I explained earlier, there's 2 different categories that you're going to see here. Under rapid rehousing, traditionally, providers would apply a percentage of their budget, generally somewhere between 25 and 28% of your budget, for what we call the supportive services, which is case management and housing navigation. And as we go down through here, you're going to see there's a separate service that applies only to the case management and the housing navigation. Here with the attachments, these attachments are the same as the first service that we discussed. You would need your agency assurance form. If you're an NPO, you're going to need your IRS 501c3, a public crimes, entity crimes affidavit, and then a list of your board of directors. For your program documents, you would again need the Gantt chart. Again, this needs to be specific as to how you would get the program up and running. Document 3 would be any MOUs, MOAs, or interagency agreements. Document 4 would be any resumes or job descriptions for your funded staff under this contract. And then document 5 would be a table of organization for those staff responsible for the oversight of this program. These specific documents are for housing only. So document number 6 is a unit vacancy form that is in the packet. Make sure you fill that out completely. The applicant's flex fund policy, again, that was a form that was needed in the previous service. Project intake plan, client discharge and termination procedures, and then your HMIS activity plan. The eligible expenses, again, administrative expenses, case management, client incidentals, rental payment assistance, temporary flex and financial assistance, housing search, which is your housing navigation, and the COVID-19 control. The next service is a new service, as I mentioned earlier. This is the mobile sanitation projects for $400,000. And again, this could be more than one provider who could apply for these funds. The ESG funds will be the purpose for deploying and coordinating and cleaning of mobile sanitation equipment, such as portable restrooms, showers, hand washing stations throughout all of Broward County. What's really important to note here, it must be throughout all the 3 regions of Broward County. So if one provider was going to submit for this, you would need to have a plan for the north, the central, and the south part of the county. The funds can also be used to apply for personal protective equipment for families and individuals who are experiencing street homelessness. Again, these attachments do not change. They are the same as the ones listed previously. And then we'll go to the program documents. Since this is a new service, and it'll be very important, again, the Gantt chart, how will you implement, how will you operationalize this in a very quick manner. Program document number 3 is the MOU, the MOA, and interagency agreements. Document number 4, resumes and or job descriptions for funded staff. Program document number 5 is the table of organization. And then program document number 7 is the policy that your organization has with respect to flex funds. Here are the eligible expenses under this category: administrative costs, client incidentals, temporary flex funds, homeless outreach, and then the COVID-19 control. The next service that we're going to discuss is the ESG Essential Services. ESG Essential Services is a specific category under the Emergency Solutions Grant, and we have $250,000 eligible for funding in this category. This is Emergency Shelter Services provides funding to operate emergency shelters and provide potential supportive services to individuals and families experiencing homelessness. In the RFP, it's outlined very clearly what is an eligible expense under shelter operations. This is shelter beds are not an eligible expense under ESG Essential Services, but rather the operations of a shelter are. The funds can be used for certain operating and social service expenses in connection with any emergency shelter. So attachment A, here we are with our attachments again. The agency assurance form, the 501c3 verification if you're an NPO, the public entity criminals affidavit, and then if you're an NPO, we would need your list of board of directors. Here's your program documents. Again, the Gantt chart. I cannot express how important this is because these are funds that have a very quick turnaround. Program document number 3 is MOUs, MOAs, and interagency agreements. Program document number 4, any resumes or job descriptions for funded staff. Program document number 5, table of organization for those staff responsible for program oversight. And then program document number 7, again, refers to the flex fund policy for your organization. Eligible expenses under this: emergency shelter, administrative services, and the COVID-19 control. I put an extra slide in here because what's very interesting and kind of exciting about the shelter services, that there's a lot of interesting costs that, as I spoke about earlier, eligible will include the case management, childcare, education services, employment assistance, job training, outpatient services, legal services, life skills, mental health services, substance abuse treatment services, renovations. This is very clear in ESG, and if you need further clarification, the regs for the Emergency Solutions Grants go into exactly what renovations are allowed. Linda mentioned traditionally in some of our RFPs, there's been some disallowable expenses, and generally capital expenses are those. However, in just this specific service, renovations are qualified. Shelter operations for transportation and or services for special populations such as youth experiencing homelessness, victim services, and people living with HIV/AIDS. Our final service here is the case management and housing navigation. We've allotted approximately $400,000 of available funding. Housing navigation and housing search is a person-centered process that ensures the timely access and coordination to services. What we had discussed is this is a very big gap in our continuum of care. What's important is for all of our services, the objective is to house people. And what we need is providers who will provide services throughout the continuum, not just for the organization you serve, but throughout the continuum to provide housing navigation and case management. Our goal is to get people in units. And this service, as I mentioned before, can be provided as a standalone service without the provision of rental assistance. Here's your attachments again: agency assurance form, you're an NPO, your IRS, your public entity crimes affidavit, and then a list of your board of directors. Program documents, again, the Gantt chart. This will, again, I can't emphasize enough for this service specifically. If you need to hire staff, you're going to reallocate existing staff. But again, the turnaround, I cannot emphasize this enough, the turnaround time on these funds is very quick. Your program document number 3 is your MOUs and your MOAs and interagency agreements. Document 4, resumes or any job descriptions for funded staff. Program document 5 is a table of organization for those staff responsible for the program. And again, document number 7 is your flex fund policy. Eligible services are the administrative services, your housing management navigation, client incidentals, temporary flex and financial assistance, and then the COVID-19 control. And I'll turn it back over to Linda Kruppel.
Thank you very much, Dr. McGuire. Do we have any chat questions? Thank you. So one of the things that I'd previously mentioned is a use of the specific spreadsheet for the service area that you're responding to. For Ryan White medical RFP budget, that has to go on that specific sheet. For HIP ESG housing, that has to go on that specific sheet. Do not intermix them. So what you're going to go ahead and do is all of these topic areas where we reference the eligible services for billing, you're going to go ahead and take that service description or the service number that's referenced in the RFP and go to the taxonomy listing in the provider handbook that's on the CPD website page. You're going to go ahead, put that in. It's going to give you the formal definition, and it's going to give you the eligible unit rate. That's how you're going to start to develop your budget to provide the proposed service. When you fill out your spreadsheet, there's an instruction tab on the very first tab. It says very big instructions. I strongly encourage you to print that out and follow it as you develop your budget. It's very important. It's very self-explanatory if you follow the directions. Only enter amounts or percentage numbers in blank and appropriate cells. The spreadsheet does contain preset formulas that calculate the subtotals and totals. If you do add anything, it is the applicant agency's responsibility to ensure that the calculations submitted with their proposal are correct. That is totally up to the applicant agency. There are 3 other tabs in addition to the insurance in addition to the instructions. It's the budget summary tab, the unit cost reimbursement, and the budget narrative form. I would encourage you to do the budget narrative first because that's going to be your specific information. When you get to those totals, the totals are what you're going to put in
your budget summary and the unit cost reimbursement. Everything should match. We do a budget score, and there should be no reason why you don't get all 5 points assigned for that, because the totals should match. We do request, because we're having electronic submissions, we do request that you follow the protocol suggested in the RFP. So for your budget file, your agency name, if it's a long agency name, you can use an acronym and just let us know in your email that when you're submitting it, exactly what your legal name is. The service name, indicate that it's budget, and just use FY21 HS and MSS. That's how we're tracking this particular RFP. So when you complete your proposal, there's several different components. The first one that you're going to fill out, that's the PDF form that I mentioned earlier. It's Appendix 1, proposal form, and you have to fill out one for each proposed service. So if you're going for mobile sanitation, you would fill out one proposal form for that, program documents, attachments, and a budget. If you're going for any other ESG service, you would need to fill out a separate proposal form for that, program documents, attachments, and a separate budget for that service proposed. Likewise, same thing for the Ryan White services. If you apply for 3, you must submit an email, one email per proposed service that contains a proposal form, attachments, program documents, and budget. You must make sure that all of the documents are legible and contain responses. So when you're filling out PDF in this assigned response area, if you keep on typing and the words get really, really small, remember, raters need to read your responses. So if it gets very small, then I would encourage you to remove some of that and add a separate document, a separate Word document with the section and question number at the top of the page, and then continue writing your response there. It has to be legible. We would like to see it comparable to Arial size 12. If there's not enough space, again, add another Word document per question, or note on one document your response to each question, as long as it's easy to find for the raters. Because if they can't find it, they can't give you a rating for that particular response. All additional responses will be put, or should be put, on after Section G, which is the Service Evaluation and Quality Assessment section. So here's the list of the file protocols for saving that we would recommend that you use. We have to have your agency name and the service area that you're proposing. The Appendix 1 would be your proposal. The attachment, go ahead and for attachments and programs, those can be put together in one PDF file as A and PD. Budgets, again, please follow the recommended naming protocol, because we have to make sure that we can track each part of your proposal. That's why we're requesting agency name, service name specified. Again, I'm reiterating because this is critical, one email per proposed service. There is a proviso. The Broward County system will not allow acceptance of an email greater than 50 megabytes. That's non-negotiable. I tried. So if your file size is very big, then please, in your email, send one file per email and just note that it's your agency and note what file it is so that we can keep everything together. If a file is returned to you as undeliverable, HSD is not responsible if the file size was exceeded. So again, let me reiterate, the total size of the email must not exceed 50 megabytes, or it will be returned as undeliverable, and that would be the same as us not receiving a packet on time. Submitting to the proposal, prior to Wednesday, December 2nd at 5 o'clock. Send your emails with the proposal form, attachments, program documents, and budgets only to hsdproposals@broward.org. We are not accepting any hard copies for any reason. Please make sure that you send it to hsdproposals@broward.org. If you want to send a test email, that's fine. I'm monitoring that email, and I would be very happy to hit reply and acknowledge that I received your test email. But it's critical that you only use that email and no other email that was ever published in any prior RFP. Verbal questions regarding the RFP application will not be accepted after today's workshop, so do not call the section administrator. Do not call, if you have an existing contract with the Community Partnerships Division, do not contact your contract grant administrators. Only written responses, written questions will receive responses after the end of today's workshop. If it's found that a clarification is needed after today's deadline, after the workshop ends, we will go ahead and post that on the website. I'm the contact person, Linda Kreppel, for this RFP. And again, I'm only looking for emails and information sent to hsdproposals@broward.org. The contact information is on page 6 of the RFP, and the email is located in various places also in the published RFP. So, we haven't had any questions come through the chat room yet, but this is the last opportunity to submit questions and receive a response from staff. Any questions? Okay, we'll give it a couple minutes. And other than that, no? Okay.
No, there is a question.
We're having a little technical difficulty with the chat. We're unable to see the full chat, but we can see it up in the room where he is recording it.
Okay.
So my suggestion would be that we could respond in writing to everyone who has a question in the chat that we cannot read fully to make sure they get the adequate answer.
That sounds like a wonderful solution. Thank you, Dr. McGuire. So, because we're having some technical difficulties reading the chat room live, we'll go ahead, we will respond to your questions in writing, and you should receive it, and receive responses. They will be posted in accordance with the dates previously indicated. Thank you very much for sharing your day with us, and we look forward to working with you. Thank you.